could you talk a little bit about these boosters and whether or not mixing is advisable or not advisable, or if it's okay?
Well, the short answer is, as highlighted in the fourth section over here, that yes, it is okay. And it's okay in the booster dose section. So you would in most cases, if you get in the initial vaccines, if you are just starting out getting your COVID vaccine series, which will be termed the primary series, you would want to stick with the same vaccine for the primary series. So if you're starting with Pfizer, you would likely want to stay with the Pfizer vaccine for the second dose. If you start with Moderna, you would stay with Moderna for the second dose. And for the Johnson & Johnson vaccine, you would just get the single dose for the Johnson & Johnson vaccine. When it comes to the booster dose, that is where you can actually have a selection. So if you started the primary series with Pfizer and you go to a location that may not have the Pfizer available, it's more important to get the booster dose than not. And so you can get the Moderna vaccine if that's available there. And likewise with the Moderna, you can get the Pfizer. The recommendation for the Johnson & Johnson vaccine is to actually have the booster dose as one of the mRNA, which are the Pfizer and the Moderna vaccines, as the booster for the Johnson & Johnson. But if it's not necessary, if the patient prefers to stay with the Johnson & Johnson vaccine, that's fine too, if that's available. So the answer to that is yes, you can mix and match.
Just for boosters, though, not for those.
For boosters, correct. Yeah, there are rare cases. It's not often done, but there's also exceptions. As I note in the second point, if indeed there has been a rare adverse effect to a specific vaccine on the first dose, you obviously do not want to expose the patient to that same effect, in which case you can in fact change the dose of that vaccine to a second one. So if you have an effect of the Pfizer one, then you can get the second dose as the Moderna and vice versa.
Okay. And should people speak to their physicians or their pharmacists about that if they're concerned about that?
Yeah, normally you would refer to your medical provider if there's been an extreme reaction to that, and then we can just get an assessment of that to determine that the other vaccine would be appropriate rather than sticking with the same one.
Okay. All right. Who is eligible right now to receive the booster? I think it's 5 and up for vaccines now. What about
That's right. So booster doses are really available for 12 years and above. Really, they haven't got to the point where booster doses are recommended for the 5 to 11-year-old patient set over here. But in the 12 to 17-year-old groups, those would use the Pfizer vaccines. And the caveat that I was talking about in terms of getting the different doses does hold for adults 18 years and older. However, the 12 to 17-year-old set demographic, the Pfizer vaccine is the only one that's approved at this time for that age group. And so within that age group, they would need to get the Pfizer vaccine as the booster dose as well. So there's no mixing and matching at this point for that age group. But everyone else over 18 can actually mix and match for the booster dose. And so really the booster doses are for anyone that is 12 years and above. And at this point, of course, this is a very dynamic situation, so things change on a daily basis.